Hello, my name's Dr. Costa Karihaloo, and this is my colleague Dr. John Garney. Welcome to Surgery Central. In this practice, we perform a wide variety of abdominal surgeries. One of our specialties is surgery for weight loss, or bariatric surgery as it's known.
If you're contemplating having weight loss surgery, this DVD will show you a lot about what's involved in the process.
Obesity and morbid obesity, and its impact on our nation, has become one of the major health issues of the 21st century. Since 1990, the number of obese Australians has more than doubled, and as a result, the health problems associated with obesity, such as diabetes, heart disease and joint disease, are also on the rise. How do we measure obesity? We use a system called the Body Mass Index, or BMI. BMI is calculated by dividing your weight in kilograms by your height in meters squared. For example, a person who weighs 120 kilograms and who's 160 centimeters tall has a BMI of 120 divided by 1.6 squared, giving them a BMI of 46.8. Obesity is defined as having a BMI greater than 30. Morbid obesity is defined as having a BMI greater than 40, or being more than 45 kilograms above ideal body weight. It's associated with a significantly increased risk of disease and can reduce life expectancy by 5 to 20 years. It's well acknowledged that once an individual becomes morbidly obese, the chance of long-term success in controlling their weight with diet and exercise alone is very slim. In fact, diet and exercise are not successful in 98% of cases. Large long-term studies have shown that the only way for a morbidly obese person to permanently reduce their weight is through weight loss surgery, and this has led to improvements in their associated health problems, in their quality of life, and a reduction in their risk of death. We know that with weight loss, improvement is significant with weight-related health problems, including diabetes, high blood pressure, sleep apnea, infertility, and degenerative joint disease. For weight loss surgery to be successful, you need to make a commitment to good eating and permanent lifestyle changes. And our practice is supportive of that commitment through the help of our dietitians, nurses, psychologists, and rehabilitation services. Weight loss surgery is not for everyone, but it should be considered by anyone who's morbidly obese or who's obese and has significant health problems associated with that. The suitability for surgery and the exact choice of operation varies depending upon the person's age, their health, and what their expectations of surgery might be. One of our resident dietitians, Kathy Harbury, will now talk a little bit more about the dietary changes associated with surgery.
When you have weight loss surgery, you'll need to follow some special diets before and after surgery. These will be explained to you, and they are to make surgery as safe as possible. The diet before surgery is very low in calories. You'll need to follow it for a minimum of 2 weeks and eat 3 Optifast products, low starch vegetables and fruit. You'll need to begin taking a multivitamin daily and drink plenty of water. Being able to stick to the very low calorie diet predicts your ability to lose weight. It shows us that if you don't lose weight on this special Optifast diet, you may not lose weight with surgery. After surgery, you'll need to see me at least twice to go through your eating plan and to check your progress. We'll monitor your weight, we'll check that you're eating well and that you're eating for nutrients such as protein, vitamins and minerals. You'll progress through a few different stages of food textures. The first phase is nourishing thin fluids, then soft and puree textures, and then the gradual introduction of harder, more normal textured foods. If your weight loss is slower than we'd expect, we'll look more closely at both eating and exercise to modify any aspects of your lifestyle which may be working against your weight loss. Surgery alone doesn't make you lose weight, but it is a very useful tool. Surgery allows you to reduce the amount of food that you eat without feeling any hungrier. However, it is very important to realise that there are other behaviours unrelated to hunger, such as grazing and comfort eating, and these can take longer to change.
Most of the obesity operations we perform are undertaken at Lake Macquarie Private Hospital. This is a Ramsay hospital across the road from our practice in Gateshead. Let's now go on a short tour of Lake Macquarie Hospital and you'll see the areas you'll encounter during a hospital stay. One of your questions no doubt will be about the cost of your surgical procedures. For patients with private health insurance, the health fund will cover the majority of their hospital costs and a proportion of their surgical costs. You can check this, of course, on our up-to-date website and also contact your health fund.
At Surgery Central, we perform 3 types of weight loss surgery: sleeve gastrectomy, gastric bypass, and gastric banding. All these procedures are performed laparoscopically, which means keyhole surgery, but occasionally open surgery is required. All the operations work primarily by restricting the volume of food that can be eaten. We'll now go through each of these procedures. Laparoscopic sleeve gastrectomy originated as the first stage of a 2-stage operation in the super-obese. It was so successful in that setting that it's now performed as a standalone procedure. It is, however, the only completely non-reversible bariatric operation. The surgery is performed through 5 keyhole incisions, although one is made slightly bigger to remove the excised stomach. The operation involves removing 3/4 of the stomach, leaving a long, skinny tube roughly 1 centimetre in diameter and the volume of a banana. This leaves a long line of staples which are reinforced in several ways. The most significant complication of this procedure is leakage from this line of staples, which occurs in around 1% of cases. The surgery takes between 1 and 2 hours and your total hospital stay is usually 4 days. With the gastric sleeve, there's no need for long-term follow-up for adjustments. There are rarely nutritional problems and generally no food intolerance.
Gastric bypass is the most established bariatric operation and has been around since the 1960s. This operation has always been considered the gold standard in weight loss surgery. It is principally a restrictive operation where the stomach is partitioned into a small pouch. This pouch then empties into the small intestine, which is joined onto it. The surgery is now usually performed laparoscopically through 5 or 6 small incisions. The stomach is divided into a small pouch, the small bowel is then divided, the downstream or roux limb is then brought up to the small stomach pouch and a join or anastomosis is made. The upstream part, containing the digestive enzymes, is joined to the roux limb roughly 1 metre along. The total distance of bypass bowel varies between 1.5 and 2 metres. With gastric bypass, ingested food bypasses digestive juices to some degree, and this leads to a slight reduction in the amount of nutrients absorbed. When food enters the small bowel, it sends a message of fullness, and this procedure also seems to have a specific effect in improving diabetic control. The operation takes between 2 and 4 hours to perform. Total hospital stay is usually 5 days. The gastric bypass does require specific follow-up.
The gastric band is currently the most popular procedure for weight loss in Australia. This popularity is because of the operation's perceived safety. The gastric band works by obstructing the passage of solid food through the stomach. This stretches the stomach wall above the band, which sends signals of fullness. It's a restrictive operation which is performed by keyhole or laparoscopic surgery. A silicone band is placed around the very top of the stomach. This creates a tiny gastric pouch above the band. This reduces the amount of food that can be eaten and the speed at which it can be consumed. It works best with solid food, which stretches the wall of the pouch, triggering a feeling of fullness. With time, the opening between the pouch and the rest of the stomach may enlarge, leading to less feeling of restriction. The band can be adjusted by injecting fluid into the access port, which is secured onto the muscle of the abdominal wall, under the skin and fat. Of all the weight loss operations, gastric banding is the least effective in terms of weight loss and requires the greatest degree of follow-up. Once a band's inserted, it requires a commitment to lifetime follow-up with the dietitian and the surgeon. Recovery is 4 to 5 days in hospital for a sleeve gastrectomy. With gastric banding, you can often go home within 24 hours. Gastric bypass requires 4 or 5 days in hospital for a laparoscopic procedure, but 7 to 10 days for an open operation. Once your surgery is completed, we encourage patients to resume their normal activities as early as possible, gradually building up their exercise as their energy levels improve. Most people are back at work by 2 or 3 weeks after surgery. As with all surgery, there are several significant concerns. The decision to undergo an operation cannot be taken lightly. Severe complications and even death can occur. There are risks associated with all surgery which relate to anaesthetic, infection, bleeding, blood clot formation and pain. Keyhole surgery carries certain risks which are unique to it, relating to damage to adjacent organs. And this is very rare, but can be very significant. With sleeve gastrectomy, there's a 1% risk of leakage from the staple line, and this can be a very serious complication requiring open surgery and a long stay in hospital, which may even be months. Some people develop reflux after surgery, which may require medication. But beyond these problems, the operation is very much a set and forget operation.
Gastric bypass has the greatest risk of complications. There's up to a 5% risk of leakage from the various joints, which may require reoperation. Down the track, there's a risk of ulcer formation and narrowing at the joints, which may require further procedures to fix them. There is a lifelong risk of forming internal hernias between the loops of bowel, which may cause bowel obstruction and require surgery in up to 5% of cases. There is also a risk of vitamin and mineral deficiencies, which require careful follow-up and monitoring.
With gastric banding, there's a 1 to 2% risk per annum of requiring revision or removal, and this is generally because the stomach slips under the band or due to problems with the prosthesis, or even erosion of the band into the stomach. These problems do not usually prevent a new band being placed. As part of our practice philosophy, Surgery Central is committed to research. This helps to improve patient care. This means that all our results are collected on a database, and these results have been and will continue to be presented at national and international meetings. We're also committed to lifetime follow-up of all our patients. One of the key questions is, how much weight will I lose? This graph shows typical weight loss for a 130 kilogram patient whose ideal weight is 70 kilograms undergoing weight loss surgery. This patient has excess weight of 60 kilograms. With the lap band, 50% excess weight loss can be expected, that is, about 30 kilos, and this occurs gradually over 3 years. With gastric bypass and sleeve gastrectomy, roughly 65% excess weight loss is seen at 18 months. The longer term data suggests that this is sustained beyond 10 years with the gastric bypass. The longest published data for sleeve gastrectomy is currently 8 years, but it does also suggest that weight loss is sustained. Please remember these results are averages only, but the general rule after weight loss surgery is that people don't lose all of their excess weight, but a proportion of it. And for every person who manages to lose all of their excess weight, there's another person who loses little or even no weight. In the case of gastric banding, 1 in 5 people will lose less than 10 kilos. But our experience with gastric bypass and sleeve gastrectomy is that this is a much rarer occurrence.
Weight loss surgery is not a miracle cure or an easy way out. It is major surgery. For its best effect, it must be accompanied by the establishment of good, healthy eating habits. All weight loss surgery limits the quantity of food you can eat at any one time, but to achieve the greatest success from whichever procedure you have, you will need to make changes to your daily food habits. The necessary changes to your present eating habits will be yours to make, but the pride you'll feel in achieving weight loss will be yours to savour. Significant weight loss has psychological aspects. You can expect changes in your relationships, and you may have some change in your body image. Most patients have some difficulty adjusting to their new eating habits, and some patients find difficulty replacing the role that eating had in their lives. These issues can all cause stress. Psychological support is available where it's needed. As a rule, we advise the adoption of an exercise program as soon as you're thinking about having an operation. After surgery, particularly laparoscopic, you can start walking after a few days. In general, however, we advise a 6-week break from lifting heavy weights. If you are considering weight loss surgery, then the process begins by getting information, such as viewing this DVD. Your next step, then, is to make an appointment. At your appointment, we will discuss together whether surgery is suitable for you and which operation is best.
If you choose to proceed to surgery, you'll need to spend some time with the dietitian and also to see the psychologist. After that, we'll have a second appointment where we'll finalise our financial arrangements and also arrange for you to see any other doctors that you might need to see to optimise your fitness for surgery. All these matters will be discussed so that you're comfortable in proceeding to surgery.
For many patients, talking about diet, body image and weight loss is difficult for them to do with family, friends and their own GP, but you can be assured that at Surgery Central we'll do our very best to answer all your questions and put your mind at ease. We really look forward to meeting you.